Okay. Hit escape. New share. And syllabus. Share that. There we go. All right. So today, come on. All right. All right. Up one, two, three. Okay. And we've got digestion, absorption, and metabolism, and review for your first exam. All right. So get that out here. Okay. List. All right. Yes. Mm-hmm. All right. United Swedish. Swedish fungal digestion. There we go. Mm-hmm.
Mr. Converse, I sent you a message. Can you let me know if that's okay?
Was it about your homework?
No, I said I had to leave class at 11:30 today, and I just wanted to make sure. Okay, is it?
Yeah.
Is it just the test that we have due on Sunday?
Yeah.
By 11:59. Okay, thank you.
Mm-hmm. Digestion. Not 100.
Bionic.
Yeah, let's go. Kind. Okay. Okay. Yeah. All right, let's do this.
It's a few people that's trying to still get in class.
They have the. They should be able to get in, right? They're not in the waiting room. Yeah, I see that. That's not what I'm after here.
Hmm?
Milk, please.
Let's do this. Okay. There we go. And this. Where we at? Let's see here. Chapter 15. Turn 135. See. Yeah, that's what's wrong. Let's go there. Okay. Okay. There we go. Okay. All right. Yep, that's it. So, all right. Start with this. And then we're going to Zoom share. We're going to do a new share. And then we're going to go here. Share that. There we go. Okay. So today we're going to deal with the digestive system. Okay. And the role of the digestive system is to take your food that you ingest, that you stick into your mouth, and then to mechanically and chemically break it down. So what do we mean by mechanically break it down? We mean to grind, mix, and churn the food so that you physically break it into tinier pieces. Okay. And by chemical breakdown, what we mean is to take special tools called enzymes, which are proteins that can help to break down your food at the chemical level, right? Make smaller molecules out of the bigger molecules. So to ultimately break down your proteins into amino acids and break down your complex carbohydrates into simple sugars, and to break down your fats into fatty acids and glycerol. Okay. And we also need to absorb your vitamins and your minerals. Okay. A fair amount of water, right? And that's all used by your cells and tissues to keep you alive, right? The reason that you eat, as we discussed earlier, is to make sure that you have building blocks to put together the molecules that make up your body, and you have the energy to put those building blocks together. Okay. So we start with this idea of the alimentary canal. And I know it's kind of weird, but all your life you've been a walking donut, right? You have an opening that goes right through the middle of your body from your oral cavity, your mouth, all the way to your anus. So the food that you eat really isn't inside your body until it passes through the lining of your digestive system and into either your bloodstream or your lymph. So your waste products that come out the back end are never really inside your body. They're just sort of passing through the middle. Okay. So this is a cavity in the body that's open to the outside world at both ends. And that's why it's lined with what we call a mucous membrane, which is a layer of tissue that makes a liquid called mucus, which flushes the tract, traps pathogens and particulates, and also helps to lubricate stuff that's moving through the pipe. Okay. So it's the perfect kind of lining for something that is exposed to pathogens, which are always in our environment, around us, on us, and in us, right? And what we need to always make sure that we do is to take care of the fact that we don't want to get those pathogens into our blood, okay? And so this is part of what helps us do that, all right? So this is the digestive system here. It's pretty straightforward in terms of its anatomy, right? Let's use green here. Okay. It starts at the oral cavity. And what we have here are the teeth, the tongue. These are the salivary glands. Okay. The lips, the cheeks. All right. Food moves through the oral cavity and into the pharynx. Right. That's your throat. Your pharynx has three parts. The nasopharynx is behind your nasal cavity. Your oropharynx is behind your oral cavity. And your laryngopharynx is behind your larynx, which is your voice box, right? So the food passes into the pharynx and it goes down this long tube called the esophagus. And that opens into an organ called the stomach, right? Well, the opening is called the cardiac sphincter. That's the doorway into the stomach. And it gets that name from the fact that it is near the heart, okay? The food drops from the esophagus into the stomach, where the stomach produces something called gastric juice. Now, what is gastric juice? Gastric juice is a mix of the hydrochloric acid, which is very corrosive, and also something called pepsin, which is an enzyme that begins breaking down protein. All right. The stomach also produces a mucus that protects its inner lining from its own acid, or else the stomach would actually eat a hole in itself and tear itself up. And occasionally the stomach does do that. And we'll get into the reasons why later. Okay. So what's happening in the stomach is that the food that dropped into it from the esophagus is getting liquefied and sterilized, and the proteins are getting broken down. Then what will happen is that the stomach will squirt that liquid into the first part of the small intestine, which is called the duodenum. All right. And at the same time that that happens, the gallbladder and the pancreas, which is right behind it, will squirt their contents into the duodenum. So the gallbladder contains something called bile, and the pancreas is going to introduce bicarbonate and a bunch of enzymes, which are going to help further break down the food, the nutrients in the liquid coming from the stomach, which is now called chyme. Okay. The purpose of the bile is to act like a soap in order to break up droplets of fat that are in the chyme and make it easier for the enzymes from the pancreas that digest the fat to do their work. Okay. So that process will continue through the duodenum into the jejunum and then finally through the ileum. Those are the three parts of the small intestine. That's this coiled tube that's all through here, right? And then what will happen is that when you get to the end of the ileum, all right, all you'll have are waste products, and they'll go through an opening called the ileocecal valve and enter this little pocket here called the cecum. They'll work their way up the ascending colon, across the transverse colon, and then down the descending colon, and then finally into the sigmoid colon, and then out the rectum and the anus. Now, while that's going on, what's going to happen is that the water in the waste will be reabsorbed. Okay. Bacteria in our colon will break down our waste because they use it for fuel. And the bacteria will also produce some vitamins that we need, like vitamin K and B complex vitamins, and we'll absorb those across the lining of the large intestine and into the blood. And then muscle contractions will eventually move this all the way through this pipe to the rectum and the anus, and then it comes out the other end when we have a movement. Okay. The liver and the salivary glands and the gallbladder are what are called accessory organs, right? The liver's job for the digestive system is to make the bile that gets stored in the gallbladder. The job of the pancreas is to make digestive enzymes and bicarbonate and squirt them into the small intestine, okay? And the salivary glands produce saliva, and they squirt that into the oral cavity, okay? So that's the basics of it, right? Now, if we start at the beginning, right, the oral cavity has a tongue, right? The tongue is mucus-covered skeletal muscle that has a rough surface on it, and that rough surface is made up of structure called papillae, and those are like little grippers, okay? Just like you have a tread on the sole of your shoes, the papillae are like the tread on your tongue, right? So that helps it to manipulate the food and move it around inside your mouth. And on the lateral sides of the papillae are your taste buds. So the taste buds are how we pick up flavor, right? And what they do is they talk to nerves that go back to your brain to provide you taste sensation, all right? And when you take anatomy, you're going to learn that those cranial nerves are 7, 9, and 10, okay? That's not important for us. Just know that there's nerves that bring that back to your brain. The lingual frenulum attaches the tongue to the floor of your mouth so you don't swallow it, okay? And then you got a hard palate on the top of the oral cavity that keeps food from going into your nasal cavity, all right? The hard palate is made from the maxilla and the palatine bones. And again, you'll learn that in anatomy. And behind that is the soft palate. And that ends in something called the uvula, which looks like a little speed bag that boxers use to practice on. And the purpose of the soft palate is to seal off the nasal cavity when you swallow so that you don't send food up into your nasal cavity, okay? Sometimes children are born with an opening in their hard palate, and when they swallow, food and liquid go into their nasal cavity and they choke, right? And so they have to have surgery to fix that so that they can eat normally, right? The teeth are the tools of ingestion, right? We have 20 baby teeth. They're called deciduous because they fall out. And then we got 32 adult teeth, which are in the maxilla and the mandible. Maxilla is your upper jaw, and the mandible is your lower jaw. Okay. You got 4 incisors per jaw. Okay. Those are the sort of flat blade shaped teeth that are for chopping. You got 2 cuspids, which are your fangs per jaw, and that's for slashing. You got 4 bicuspids per jaw and 6 molars. Okay. And those bicuspids and molars are for grinding, right? When you look at a tooth, the tooth has a crown, which is above the gum, which we call the gingiva, and it has a neck, which is below the gum, and a root, which is below the gum, okay? So the crown, right, is covered with enamel, and the rest of the tooth is only covered with something called cementum. The enamel is a good guard against bacteria that live in your mouth and live off of the food that you eat, right? But the rest of the tooth from the neck to the root is less well protected. So sometimes when you don't have good dental hygiene, what happens is that those bacteria will produce something called plaque on your teeth. That's what the dentist is scraping off with those tools when you go for a cleaning. And in the plaque are bacteria that produce acids that can eat away at the enamel. And so when the dentist is probing your teeth, that's what he's looking for. He's looking for soft spots in the enamel where he may have to do a drill and fill, okay? And then if you don't take care of your teeth, eventually what's going to happen is that the acids can make their way through the enamel and into the softer part of the tooth, which is the dentin, okay? And then from there, it can get to the pulp cavity or the root canal where nerves and blood vessels are at. Eventually, those bacteria can get in between the little gap that's between the tooth and the gum, right? So you can see that here. That little gap is called the gingival sulcus, right? And what will happen is that that'll make the gums inflame, and then they can recede, right? And if they recede, what will happen is that the bacteria will go up and under the crown and get into the soft dentin through the cementum and get right into the pulp cavity. And the reason we worry about that is because the blood vessels there can get infected, and then you can have sepsis, and that's real bad. So if you're in danger of that, what we have to do, if it gets to that point, right, is that we have to scrape your gums and we have to pull all your teeth and then give you your third set of teeth, which you know better as your dentures, right? And you don't want to have to do that. So you can see here, right, you got the molars and the bicuspids, right? Those are your grinders. There's your canines here and here, right? And these up here, these are your incisors, okay? This is the uvula. That's the soft palate. There's your tongue, right? And then all the way back in the back, that's your oropharynx, right? And then these little things here, these are tonsils. They guard the opening into the throat against bacteria. The tonsils contain white blood cells that can kill pathogens if they get trapped in the tonsil by eating them up, chopping them into pieces, and then warning cells called lymphocytes that those bacteria might be in the area. And so they need to multiply and go out and kill anything that looks like that, okay? So that's the purpose of your tonsils. And you probably are aware that occasionally your tonsils lose the battle. And when they do, you have to have them out. That's called a tonsillectomy, okay? And the reason that you have to do that is because at the point where they lose the battle, they become a source of infection instead of a protection against it, right? And so what that results in then is that they can actually spread the infection. So that's why I've got to take them out. And you've got plenty of immune protection if you lose your tonsils, that you still should be reasonably healthy, okay? Your teeth are held in your jaw by what are called periodontal ligaments. You can see them here, okay? And they form a special joint called a gomphosis. And when you have gingivitis and periodontal disease, what happens is that this gets loose and then the teeth start coming out. Okay. And so that's bad news. All right. And if we think about the tools that you've got in your mouth, right? This is what we call the dentition of an omnivore, right? This is our creator's way of telling us what we're supposed to eat, which is equal parts of everything, right? Meat, vegetables, fruits are designed for these tools, right? Because you got slashers, you got choppers, you got grinders all in here. If you look at the teeth of animals that have a different diet, okay, and let's look at some of those for a second. Come on now. Hello. There it is. I'll go up here. Okay. Hold on. Hold on. Hello. Okay. So if we look at, I just want to see where we're at here. This. Let me jump to saliva interference, right? Okay, we'll keep going. All right, good. So let's look at something real quick. All right, I'm going to go here. All right, there's our German Shepherd. And then we also want to go to our cow. There we go. Okay. All right, so come on. I know you can do it. Bring it up. Come on now. In such trouble. Oh. Here we come. Blocked. I don't know why it's not pulling it up. Okay, well, What I wanted to show you, all right, was a slide of a cattle skull and a dog skull, and they're just not coming up at the moment. They're being slow. But the point with the cow skull, all right, was that, and hold on a second. Let me share. Go back to sharing that. The point with the cow skull was that if you look at it, all right, you don't see any incisors. You don't see any canines, I mean, all right. And what that tells you, all right, is that the cow is not meant to eat meat, all right, which makes sense because the diet of a cow should always be grass or grain, all right, and that's what you normally see in the feed. And if we look at a German Shepherd skull, what you'll see is that there are very few molars, right? Because that's the dentition of what we call a carnivore, right? The cow is an herbivore, so he's only supposed to eat plants. The dog is a carnivore, okay? So when you look at a dog's dentition, what you're going to see is lots of canines, some little tiny incisors, and you might have a couple of molars in the back. And that is, dentition is designed for raw meat, all right, and things like eggs, but basically a diet that has almost no plants in it, okay? If you look at your dog's mouth, all right, that's one of the things that you'll see. And an interesting thing, of course, about a dog, I don't know if anybody here has ever been bitten by a dog, even when they're just maybe playing with it, but a dog has powerful jaws. A cat does too, right? And the reason for that is that the muscles that connect to the jaws of your dog will wrap around all the way to the top of their head, and they attach to a little ridge called the nuchal crest. So the next time you watch your dog or your cat eat, look at the top of their head and you'll see muscles working. Those are their jaw muscles. And that's why a dog or a cat can do stuff like bite through bone, because they have a whole lot of leverage and power in their bite. If you look at our jaw muscles, they only attach to our cheekbones, right? Our zygomatic arches are where our jaw muscles attach. And so we can't generate as much power, all right? Back in the day, before we evolved to the way we are now, we used to have a ridge on the top of our skull where our jaw muscles attach, and we used to eat a diet that had a lot more gristle and fiber and tough stuff in it, okay? Because we had a diet more like the diet of a baboon or a gorilla, okay, who are related to us on the evolutionary tree. But at some point, we figured out how to do fire, okay? And when we figured out how to do fire, we could cook our food, and it became less necessary for us to have all of these powerful grinding weapons in our mouth. And so our oral cavity began to shrink, and our jaw muscles became weaker, and we lost that ridge on the top of our skull. And the result now is that we have just a few little remnants of those days left with us. And one of those is your third molar, which are your wisdom teeth. And you can see those here and here and here and here, right? Those come in usually in your early 20s. They get the name wisdom teeth because by the time they come in, you're supposed to have wisdom, right? But a lot of times people will get their wisdom teeth coming in crooked. They'll come in at a slant, or they might not be able to come in at all. They call them impacted, and you got to pull them out of the jaw, or else they're going to crimp your teeth and you're going to have a misaligned bite, and that's a condition that's called malocclusion, okay? So when your wisdom teeth are ready to come, what they do is they're going to knock you out, all right? You're going to go to an oral surgeon, he'll knock you out, and then he'll take the dental equivalent of pliers, right? And then let's use the pen here. He will pull with pliers these teeth right out of your jaw, okay? And it's a pretty brutal procedure because these teeth have lots of roots in them, and sometimes the roots break off, and sometimes the roots wrap around nerves and stuff. So it can be bad. So when you wake up from this, you're going to have a bruised neck, you're going to have a swollen jaw, all right? And so they'll prescribe Percocet for you and tell you to keep the area cool, pack it with ice so that you don't get as much swelling, and then you do liquid diet for a while before the swelling goes down. Now, some people aren't born with 4 wisdom teeth. Some people are born with 3, some with 2, some with 1, and there's a few people now getting born with none. So it's a characteristic that is evolving out of the population, and it's a remnant of the days when our oral cavity was bigger and our diet was way different, right? Now the cow, if we look at the cow skull, is going to be eating grain, right? So you've got the incisors for chopping, right? And you've got the molars in the back for grinding. And a cow, instead of having 1 stomach, has 4 stomachs. And he has a digestive system that's about triple the length of ours. And the reason for that is that it takes a lot of mechanical work in order to turn grass and grain into a form of nutrient that's absorbable enough to build a great big cow. That's why whenever you see a cow, what's he doing? He's eating, right? He's got his head down, he's eating, okay? And so when we mess up the diets of dogs and cows, we run into problems, all right? A dog, all right, if you feed a dog food, okay, some dog foods have a lot of grain in them, all right, which is not really the normal dog diet. And because of the grain in the dog food, the bacteria in the dog's mouth can do the same thing it does to a human mouth and give the dog cavities, which is not something that a wolf or a fox would ever have because they just eat the raw meat, okay? And I don't know if you've ever had to have your dog taken in to deal with cavities, but he has to be knocked out, have his teeth cleaned and scrubbed and pulled if necessary, and then he has to recover from the anesthesia. And that's just for a cleaning, okay? So what should you feed your dog? Honestly, it should be raw meat, okay? And they wouldn't have those problems. Now, with a cow, one of the things that people do sometimes is instead of just giving them grain, which is what they're supposed to eat, they give them feed that has bone meal in it, okay? And the bone meal has nerve tissue in it, and in the nerve tissue sometimes is the agent of mad cow disease called a prion. And so what happens when you eat undercooked meat that has prion in it is that you can end up getting mad cow disease and die. Okay, the prion is a little teeny tiny protein that can cross your digestive system to get into your blood and from there get into your brain. And once it does that, it basically instructs other proteins in your nerve cells to basically get messed up, not fold up right, not be in their native conformation. You remember that from last week, the shape in which they can do their job. And what happens is that your nervous system turns into jelly in about 2 days and you're dead. All right. This was first discovered in New Guinea way back. It was a disease that was called Creutzfeldt-Jacobs. And we didn't understand why the New Guinea natives were dying of this disease. Typically, the women and the children would come down with it after the head of the household died. And so they thought maybe it's inherited, maybe it's a pathogen. But finally, they figured out that the reason that these people were dying of this is because one of the traditions back then in New Guinea was to honor the head of the household by eating him. Okay, they were cannibals. So they would eat him front to back, including the nervous tissue. And when they did that, they would consume prion and they would end up with Creutzfeldt-Jacobs and they would die in a very short period of time. Now, we have a deer problem in the tri-state area because we don't have a lot of deer hunting. And as a result, the deer are not just in the woods anymore. They're in the city, they're in the suburbs, they're all over the place, okay? I live in Clifton, and you can walk around Clifton in the twilight, and you can see deer running up and down the street. And what do they eat? They eat your garden, they eat garbage, they eat stuff that's in the dirt. They're not eating what they're supposed to eat, which is fresh shoots, all right? And that's because they're overpopulated and they've moved into places where they're less likely to get attacked by a predator, right? Well, who are their normal predators? Wolves and foxes and stuff like that, and coyotes. And in the suburbs and in urban areas, they're safer, right? Their main enemy is the car. Okay. So what'll happen is we can get mad deer disease, and the deer have the same problem as the cows do. They're eating stuff they're not supposed to eat, the garbage. In the garbage in the soil are these prion agents, and these prion agents can get into the deer meat. And then if you eat the deer meat, you can end up with a disease like Creutzfeldt-Jakob, okay, and you can die. This is why you sometimes read about deer doing very strange things, like jumping off highway overpasses into oncoming cars and walking through plate glass windows in the middle of downtown. Okay. It's starting to affect their behavior. Okay. Because their brain is literally melting. Okay. So it's just a case in point. In order to control the deer population, what we did was we reintroduced coyotes into the area. This has been a long time ago. And the coyotes now, instead of attacking the deer, are going after the farm animals and your dogs and your cats. Okay. And they're now crossbreeding with wolves. And you have these hybrids called coy wolves that like to live in urban areas and eat the rats and the pigeons and sometimes attack the people. Okay. So where we didn't have any problems before because we had a normal predator-prey relationship, we now have all kinds of problems that we've created because we didn't allow hunting, right? When you allow hunting and you keep the population levels low, you don't have the deer coming out and being in places they're not supposed to be and eating what they're not supposed to eat, okay? So it's just a little story, little sidebar, but I think it's interesting and it points out, right, since this is a class on diet, that diet's not just important for people, it's important for animals too, okay, and for the reasons that we said. Now, your salivary glands are in your oral cavity. The parotids are in front of your ears. The sublinguals are under your tongue, and the submandibulars are under your mandible, and they make saliva. So what's in saliva? Well, saliva is water and some enzymes that break down fat and starch, okay? And then there's also stuff in saliva that impedes bacterial growth, like lysozyme and antibody, okay? So production of saliva is important in keeping your mouth from getting as many cavities as it normally would. That's why as you get older and you make less saliva, you're more prone to cavities, okay? And then we have your throat, and we talked about the three parts of your pharynx, and we talked about your tonsils, okay, and tonsillectomies. And then you can see here the act of swallowing, right, which is both a voluntary and a automatic act. So let's go and I'm going to show you a little quick video on swallowing. So discard the annotations and go to deglutition. Unless I've spelled it wrong. Let's check. Yeah, this is not going to pull it. Okay. Yeah, all right, should pull it. That's right. All right, so let's look here. All right, let's go to the fail safe. There we go. Okay. Second to come up. There we go. Let's go to this. Yeah. Okay. So it must be over here. Must be over here. So we'll go to this one. Do this. Chapter 17. So I'm guessing 26. Come on. There we go. There you go. Okay. Well, there's two. Let's go back to share here. Change share. Okay. So there's two phases to swallowing, right? There's a voluntary phase and then there's an involuntary phase. So with the voluntary phase, you chew the food, you turn it into a wet food ball called a bolus, and then skeletal muscle helps to push the wet food ball back past the hard palate, past the soft palate, and into the oral pharynx, right? So that's what we call the food at that point. It's now a semi-solid, okay? And then what will happen is that involuntary smooth muscle contractions, which are called peristalsis, will take over and begin to push that food ball down the esophagus towards the opening into the stomach, which is called the cardiac sphincter. Okay. And so that will actually propel the food and the nutrients the rest of the way through the tract, because the entire tract has in its wall smooth muscle that's designed to mix and churn and push the food forward. Okay. The layers of the digestive tract are made up of the mucosa, the submucosa, the muscularis externa, and then the outer layer, which is the serosa. All right, so let's pull out the laser pointer here and go. Let's go to blue. Okay. So this part here is the mucosa. All right, and it has extensions on it in the small intestine, which are called villi, and the villi are actually lined with a type of cell which has microvilli on its surface. All right, epithelial tissue that has little tinier extensions on its surface. So the idea here with these ridges and grooves, these finger-like villi and the microvilli, is to increase the surface area to absorb the food. Okay, that's the whole point. If you spread out the entire surface area of the digestive system, it will cover a basketball court, which is pretty impressive since it's just in your abdominal pelvic cavity. Okay. In the submucosa, we have connective tissue, and we have glands that produce secretions such as mucus that end up flushing the tract, trapping particulates and pathogens, okay, and lubricating the stuff that moves through it. And there's also going to be immune cells in the mucosa and even in the submucosa, white blood cells that are standing guard so that if anything penetrates the inner lining of the tract, it'll intercept and kill it before it gets into the blood. Okay, and we call that tissue MALT, or mucosa-associated lymphatic tissue. And then here's the smooth muscle, right? In most areas in the tract, we have an inner circular and an outer longitudinal layer, okay? And that's to either push in on the tube or to shorten the tube in the case of the longitudinal. And that's what the peristaltic movements are about, right? Is to, just like you do with a tube of toothpaste, right? You roll it from the back to shorten it, and then you kind of push from the sides to push it forward. That's what this muscle action is doing. There's a layer called muscularis mucosa in here that helps the villi sort of undulate, all right, kind of move back and forth so that you get more contact with the food that's moving through it. And the reason that's important is to help the nutrients absorb, but also to help any enzymes that are attached to the border do their work. Okay, the more mixing, the better things go. And then on the very outside, you've got serosa, which is membrane that wraps around the entire organ system to hold it in place so it doesn't twist, buckle, or kink. And it also serves as a passageway for nerves and blood vessels and what are called lymphatics, all right? And it lubricates the outside of the organ so that when it moves, it doesn't produce a lot of friction. So that's what it looks like in cross section here, right? That's the lumen, and then you've got mucosa, right? You got submucosa. There's muscularis out here, and then out here you got serosa. Okay. The esophagus is just the food tube that runs from your throat to your stomach, right? And so what will happen when you swallow is that the food will pass through something called the upper esophageal sphincter, and then will move by peristalsis to the cardiac sphincter, which is the entrance to the stomach. Okay. And then we will begin the process of protein digestion. Okay. So there's the esophageal sphincters. Okay. And there is the process of peristalsis, right? See how it's pushing the bolus down towards the opening to the stomach. Okay. Now the stomach is pretty special. Okay. The stomach allows us to do something that we take for granted, which is called discontinuous feeding, meaning that we can eat a meal and then we can stop and we can go on with our lives, right? If we didn't have a stomach, we wouldn't be able to do that. We have to eat all the time. An example of an animal that doesn't have a stomach is an earthworm. And the life of an earthworm is very simple. He eats dirt, he poops, and he makes baby earthworms until he dies. That's it, okay? Because he doesn't have a stomach, there's no pausing in that activity, okay? So kind of monotonous, but there you go, the life of an earthworm. The stomach is J-shaped, and it is at the end of the esophagus. It's between the esophagus and the small intestine. And it has little ridges in it that are called rugae, which allow the stomach to stretch out when food gets in it. Okay, so the stomach will expand as food drops in it. And then what is the stomach doing? Well, it's storing and liquefying the food, right? It starts the digestion of protein and it moves food into the small intestine, okay? The food also gets sterilized here because the hydrochloric acid is a very powerful corrosive. Not a lot of things can live in it. And the result then is that a lot of pathogens get killed while they're in the stomach before they get into the small intestine. The hydrochloric acid action needs to be restricted to the stomach. If the stomach juice, if the gastric juice refluxes into the esophagus, it'll irritate it and inflame it and it'll bleed. And that's a condition called GERD that we'll talk about when we get to GI disorders, okay? And then if it empties too quickly into the small intestine, all right, it can make a duodenal ulcer, a bleeding sore, because the acid doesn't get neutralized effectively. Normally, when the stomach empties, the juice from the stomach and the pancreatic juice and the bile come in at the same time and in about the same amount, so that the acid from the stomach that's mixed with your food gets neutralized by the bicarbonate that's coming from the pancreas. But if we don't do that, if the stomach empties too quick, then the pancreatic juice doesn't have enough bicarbonate to keep up, and you can erode the lining, okay? Same way that you can sometimes erode the lining of the stomach if you have something called a gastric ulcer, okay? An ulcer is just a bleeding sore, all right? And the danger with any of this is that if the ulcer perforates, if it goes from one side of the pipe to the other, then you have broken containment between a cavity that's not supposed to be open to the outside world and one that is, and then you got infection risk. In addition to that, the contents of the pipe will empty into the surrounding area, which is a mess, okay? In the case of the stomach getting a perforated ulcer, the acid in the stomach will begin to digest your internal organs. So that's an immediate medical emergency, okay? The stomach has different regions, okay? The cardiac region, which is up near where the esophagus comes in, the fundus, which is the domed upper portion in the body, the main portion, and then the pylorus, which is going to empty into the small intestine. So you can see those here, right? There's the fundus, there's the cardiac region, this here is the body, right? And this is the pyloric region. And those little ridges, those are the rugae. And they are what disappear when the stomach fills up, right? And the stomach, instead of having 2 layers of smooth muscle in it, has 3, right? It has a longitudinal and a circular, and it's got an oblique layer too. And that's because the stomach has to churn food in that area with the gastric juice in order for the gastric juice to do its job, right? And the stomach is lined with cells that make the acid and cells that make the mucus, okay? And cells that make the enzyme pepsin, and also cells that make hormones that coordinate the action of the stomach with the action of the rest of the digestive system, okay? So you can see all of that here, right? What the stomach is for, okay? The gastric pits and the gastric glands that make different stuff in the stomach, okay? I'm not concerned about what cells make what. I just want you to know that the stomach has gastric juice that has stomach acid in it and pepsin, which helps to break down the protein and the mucus that protects it from that juice. Okay, so we don't have to worry about the chief cells and the parietal cells and all that stuff. Okay, now this is kind of interesting. Okay, there are some things that will cross the stomach and go right into the blood. All right, alcohol and water can do that. Okay, other nutrients cannot. This is one of the reasons why if you go out drinking on an empty stomach, you get drunk real quick. Okay, because what's happening there is that the food's not acting as a buffer to help absorb your alcohol. Alcohol is going straight into your blood and into your brain, and that's why you're acting silly. Okay, so if you don't want to get drunk while you're out drinking, you need to eat food at the same time. Okay, and it's also a good idea to drink water so that you don't get a hangover, because the alcohol is a diuretic which will make you pee, and that is going to dehydrate you, and that's the source of a hangover, right? So if you put in as much water as you're losing, you're less likely to have that problem. Okay, churned food and gastric juice becomes chyme and leaves the stomach in between 2 and 6 hours, depending on what you've eaten. Okay, now the small intestine has 3 parts to it, right? There's the duodenum, which is this little short part up top. Then there's the jejunum, the part here in purple, and the ileum's the longest part here in orange. Okay, it's one continuous tube, but different things happen in different parts of the tube. In the duodenum, we mix the chyme with the bile and the pancreatic juice. Okay, in the jejunum, we absorb a lot of nutrients. Okay, in the ileum, we absorb the remaining nutrients, and then by the time we get to the end of the ileum, it's just waste products, right? And then we go through this little doorway, the ileocecal valve, into the cecum, and then into the large intestine, which we'll get to in a bit. Remember that the small intestine, since its main job is absorption, has modifications that help it to do that.
And nationwide 5G. Gonna be so fast. Can't wait to get it and start binge posting.
And so what you'll see, hold on a second. Let's go to more. Let's go to participants. Ooh. Oh, give it to me. There we go. There we go. Got it. Okay. So, yes. Good. Okay. So, the modifications include these circular folds, which are called plicae circularis, right? And they help with mixing, but also increasing the surface area. The villi are those finger-like extensions that increase surface area, and the microvilli that line those have the brush border, right, that increases the surface area even more. So if we look at the lining, right, you can see it here, right? You've got small intestine, you see the ridges, and then just blow up a little piece of it. So those are the plicae there, right? These are the villi here, right? And then if you look at the villi, individual villi, that's the epithelial tissue with the microvilli on its surface, right? And you can see that in the microvilli. These are the things that look like hairs. These are the microvilli, right? And it's all to increase surface area for absorption. That's the whole point, okay? So the idea is the more surface area, the more absorption, the better we're going to do at getting the nutrient content of your diet into your blood, in the case of your simple sugars and your amino acids, and into the lymph in the case of anything that's fat soluble, like your fats and your fat soluble vitamins. Okay, so that's the whole point of those modifications. All right, now bile is just an emulsifying agent. It's like a detergent, and you need it because the fat in your diet isn't going to dissolve in water. It's going to sit there in a big oily blob. And if we don't emulsify the fat by hitting it with something that's a lot like a detergent, then what's going to happen is that it won't be digested very well. and the result is going to end up in your stool, and your stool will float. Okay, and that's a condition called steatorrhea. All right, so in order to get the nutrient value out of the fat, you have to have the bile, and you also have to have the enzymes that break the fat down, and those are called lipases. Okay, and that is coming from the pancreas. Right. So other features, all right, include segmentation, where you've got areas of the pipe that are constricted and areas that aren't. And so when the fluid shoots through that, it mixes better. Okay. And then that, along with the surface area, helps it to do its job. Okay. Let's see here. Yeah, you don't need to know about the hormones and all that stuff. The parts of digestion are important, though. Okay. The cephalic phase is the idea that you're going to eat, right? So this is what happens when, like, you smell donuts, okay, and your stomach growls. So what's happening there is that the parasympathetic division of the autonomic nervous system is starting to talk to your digestive system and getting it ready for maybe food coming. So it starts to secrete stuff, muscle tone increases and all that. In the gastric phase, what happens is you've eaten something and it's down in your stomach, and your stomach is stretching out. Okay. And what's happening there is that you're causing the stomach to start to churn and mix, and you're also producing more gastric juice. Okay. And that's to liquefy the food. And then in the intestinal phase, the duodenum stretches out, and that causes contraction and secretion in the small intestine that feeds back to the stomach in order to pace things, right? You don't want the stomach emptying while the intestine is still in the process of moving the material through. Okay. You want to get that material moved a little distance, and then the stomach will empty again. Okay. That's why it goes in little squirts, so that we don't jump the gun. All right. And then eventually what will happen is the stomach will be completely empty. Okay. There's hormones that control this. You don't need to worry about those. Okay. What you're looking at here is just the fact that there's communication between the gallbladder and the pancreas and the stomach. Okay. And so the whole point of this, and don't worry about these hormones. The whole point of this is that the stomach needs to empty at the same time that the gallbladder squeezes, and that brings with it pancreatic juice from the pancreas. Okay. So that it all mixes together in about the same amount, so that we can neutralize the stomach acid, emulsify the fat, and continue really digestion, right? And then we're going to move from the duodenum into the jejunum, and then to the ileum, and eventually we'll get into the large intestine. Okay. So let's take a break here. Let's take 15 minutes, and then we'll come back and we'll take the rest of the trip. Okay. So I will close this out. Okay. So I'll see you guys back here at noon. Right. And then let's get the camera. All right. If you check chat, I've put the notes up there as a form to download. So you'll have access to that. All right. Let's see. Bang. There we go. All right. Share that. All right. So back where we were. Okay. Large intestine. Okay. So by the time we've gotten to the large intestine, we've taken care of getting most of the nutrients out of our diet that we need, right? It's called large because it's got a bigger diameter than the small intestine, but it's not longer. And it's made up of the cecum, the colon, the rectum, and the anal canal. Okay, and the colon has three parts: the ascending, transverse, descending, and sigmoid colon. And what's it for? It's to hold on to our waste products while the bacteria that live in there use it for nutrients and building blocks. And they will create for us vitamins that we can absorb, like vitamin K and the B complex vitamins. We also absorb water and salts here, okay? And then we store the fecal material until we're ready for elimination, all right? The cecum is the sac below the ileocecal valve where the appendix is attached. And as you know, sometimes the appendix can get jammed with material and blocked, and the bacteria in there can produce gas and can inflame the appendix, and that's a condition called appendicitis. We'll talk a little bit more about later. The colon, the parts indicated there, you'll see little like pouches along the pipe. They're called haustra, and those are created by the smooth muscle in the wall of the large intestine as it contracts, okay? And the smooth muscle here is a little strap called the Tenier coli, all right? That's a longitudinal piece of smooth muscle. Blue here, we'll go to laser. Okay, so Tenier coli, and that's going to aid in peristalsis, and then everything's going to end at the rectum and the anal canal, right? So you can see the parts here, right? There's the cecum. There's the ileocecal valve. That's where the material from the ileum is coming in, right? Ascending, transverse, descending, and sigmoid colon, and then rectum and anus, okay? You got blood supply to the whole thing, all right? And the blood that's drained from the entire digestive system goes to the liver, okay? And that's called the hepatic portal system. So essentially, we take the nutrient-rich blood from the stomach, the small intestine, the large intestine, and we send it to the liver, where the liver is going to essentially store the nutrients for later by creating glycogen and fat, okay? And the nutrient does a bunch of other stuff to that blood as well, right? It removes pathogens. It puts plasma proteins in the blood. It can help in recycling iron, okay? It makes bile and stores it in the gallbladder, okay? And it's also responsible for detoxification of things like alcohol and recreational drugs. So your liver is so important that if you lose all liver function, you die. And that's why the first four letters of the word liver spell live. That's not a coincidence, okay? These are the Tenier coli that are the smooth muscle that produce the haustra and also help to move your fecal material through the tract. And then we've got here a close-up of the rectum and the anus. There's the rectum. There's the anal canal, right? And there's the anus. There's the opening. So these are little, they're called anal columns, and they're allowed they're there to allow the escape of gas that is produced by the bacteria in the colon as they do their work. And then you've got veins here that can sometimes distend either above or below the anal columns, and that produces a condition called hemorrhoids, which we'll talk about later as well. And you can see in the lining of the colon that you've got a lot of, they're called goblet cells. They make mucus, and that's again to lubricate the pipe and to help flush out pathogens, okay? And then you've got some surface area there, but you don't have nearly as much as you have in the small intestine, okay? Now the feces are mostly water, to about 25% solids, and among the solids you've got bacteria and fiber. The reason that your fecal material is brown is because the bilirubin that's in the bile, which that one of the components of bilirubin comes from hemoglobin, okay? And that's what makes bilirubin green. Well, what happens in the colon is that the bacteria act on the bilirubin and turn it from green to brown, okay? So that's why fecal material is brown, okay? Colon bacteria are going to use the fiber in our diet and make stuff that we can use, right? The fatty acids and B complex vitamins and vitamin K are all bacterial byproducts that are important for our metabolism. And they also make gas, okay, as you're aware. So now we get to problems in the digestive tract, right? Heartburn is one you've heard of. Heartburn goes by a different name. It's called GERD, or gastroesophageal reflux disease. And what happens here is that the gastric juice, instead of staying in the stomach, flips back up into the esophagus. And what it does is it erodes it and makes it scar and makes it bleed. It can result in a condition called Barrett's esophagus that results in changes that can lead to esophageal cancer. The risk factors are obesity, pregnancy, and age, okay? So if you're heavy, lose the weight. If you're pregnant, you're eventually going to have the baby, all right? There's not a lot you can do about age, unfortunately, okay? What are some of the medications you can use? Well, you can use proton pump inhibitors to cut down on acid production, okay? And there are also medications that aid with the sphincter, but recommendations are small meals, okay? And don't sleep on your stomach, right? It's probably best to sleep on your side, to be honest, okay? Okay, gastric ulcer. We talked a little bit about this earlier, and essentially what's happening in a gastric ulcer is that there's a bacteria that's called Helicobacter, okay, that's everywhere. It's on our food, it's in the air, it's in the water. And some people are born with a lining that Helicobacter can latch onto and colonize. And when it does that, it inflames the lining, and you start to get a bleeding ulcer, okay? And that inflammation, along with the normal action of the stomach acid, can carve away at the lining of the stomach, and eventually, if we don't do anything about it, it can perforate it, okay? There are other risk factors for this, including anti-inflammatory drugs like aspirin and ibuprofen, primarily because they thin the mucus of the stomach and they make the action of the acid in the stomach more effective, okay? Stomach acid only belongs in one place. It belongs in the stomach. And that's because the stomach is built to deal with it, right? It has that alkaline mucus, but it also has a lining that builds itself up quicker than it gets digested, okay? And the other parts of the digestive system really can't deal with that. In the small intestine and in the duodenum, we neutralize that acid with the bicarbonate that comes from the pancreas. And then we keep the acid out of the esophagus normally because the sphincter shuts and keeps the gastric juice in there, right? So if we look here at appendicitis, right? Inflammation of the appendix comes from the appendix being blocked and the bacteria in there producing gas and causing the organ to swell up. If you don't do anything about it, it can rupture. Okay, and if it ruptures, then you've got fecal material in the abdominal pelvic cavity, and the result of that can be infection of the abdominal pelvic cavity, which we call peritonitis, right? Because the membrane that lines the abdominal pelvic cavity is called peritoneum. Okay, and itis just means inflammation of. And from there, you can have septicemia, which is bacteria in the blood, right? And that can lead to death. Constipation and diarrhea are really two ends of the same condition. In constipation, what happens is that the fecal material moves through the large intestine too slowly, and too much water gets pulled out. And the result of that is that it's very difficult for you to pass the feces, right? And so the fix for that is laxatives, things like Metamucil, okay? A lot of water, okay? If it sits too long, it can mineralize. And then we have to actually go in and manually remove it, okay? Mineralized fecal material called fecaliths, okay? This sometimes happens in older people. Sometimes constipation, obesity, and pregnancy are risk factors for hemorrhoids, which are distended veins in the anal canal, right? And the problem with hemorrhoids is that they can bleed. Because of their location, they can get infected. And if that happens, you've got bacteria in the blood and you have the risk of multiple organ failure. So a hemorrhoid, you know, people laugh about them. They're dangerous, okay? So what do you do about them? Well, if you either see blood in your stool or you feel something back there that wasn't there before, okay, then you go to your GP or your proctologist and you ask him to have a look at it. And then he'll make the appropriate recommendation. It might be use of laxatives. It might be, there are some topicals, okay, or it might be surgery. It all depends. In diarrhea, the fecal material moves through too quickly. Not enough water is absorbed, and you lose liquid and electrolytes. So you can dehydrate and you can have electrolyte imbalance. And so diarrhea is the body's attempt to remove a toxin or a pathogen from the body. So you don't really want to stop the diarrhea. What you want to do is replace what you're losing due to the diarrhea, which is electrolytes and water, okay? Let the diarrhea run its course, and then whatever's in there should be taken care of. Okay? Polyps are growths that can block the pipe, okay? So they can result in what's called a functional block in the pipe that can result in material building up upstream of the polyp and the pipe enlarging and rupturing, which is dangerous, okay? Small ones will produce a partial block, all right? Any blockage in the pipe is dangerous because it can swell and blow, okay? Structural blocks are things like polyps and tumors and indigestible material and twists and buckles and kinks, right? And so we can fix that surgically. A functional block is different. In a functional block, the muscle squeezing action along the pipe has stopped for some reason, and we don't really know why. And so what we have to do is we have to remove the part of the pipe that isn't squeezing anymore, and that's called a bowel resection if it's in the large intestine. And then we have to rejoin it to the functioning part of the pipe. So sometimes this involves a temporary condition called a colostomy, okay? And so what you end up with is a small bag that hangs off of your side that captures the fecal material while you wait for a second surgery to rejoin the functioning pipe to the rectum and the anus, okay? Sometimes the colostomy is permanent. It all depends on what they're working with, okay? Diverticulosis and diverticulitis are kind of like two ends of the same thing. In diverticulosis, what happens is the walls of the digestive system get weak and you get these little pouches in the digestive system that can get inflamed just like an appendix can, and that's diverticulitis. All right. And so the symptoms are very similar. So what do we do about it? Well, we recommend a different diet, right? You want a diet that's free of nuts and seeds, okay? And you want a diet that has sufficient fiber content, all right? Unfortunately, there's not a lot you can do about the pouches unless it's really bad, and then you can do surgery. But it's sort of a, you have to live with it kind of thing, and you treat it with meds and diet. The accessory organs of digestion are the pancreas, gallbladder, liver, salivary glands, okay? The pancreas is a double organ. It's an endocrine organ, but it's also a digestive organ, an exocrine organ. Its endocrine function is to make insulin and glucagon, and that controls sugar levels in the blood, okay? Its exocrine function, its digestive function, is to make bicarbonate and to make enzymes, and we call that collection pancreatic juice. And the bicarbonate helps to neutralize the stomach acid, and enzymes help to chemically break down the food that we eat, okay? So the way that this is wired up, or the plumbing here, is that this is liver up here. Liver makes bile. Bile goes from liver into gallbladder, where water gets reabsorbed and the bile becomes more concentrated, okay? And then when food comes in from the stomach, when the chyme comes in, the gallbladder will squeeze, the bile will come down the bile duct, and it will take with it the pancreatic juice that the pancreas has made, and it'll all empty into the duodenum here, along with the chyme from the stomach. And the whole thing mixes, okay? It has to do it in equal amounts so that we can neutralize the acid and also have enough enzyme there to deal with the nutrients, right? So that's why the stomach goes squirt, squirt, squirt at the same time that the gallbladder's going squeeze, 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 okay? And occasionally what can happen, as you may know, is that you can get gallstones, which are crystallized bile that can block this little pipe called the cystic duct, or can get caught down here where the pancreatic and the bile duct come together. And so when you eat, what happens in people with gallstones, if you have block here, the pancreas can't empty and the gallbladder can't empty, so they get inflamed. So that's a condition called pancreatitis for the pancreas and cystitis for the inflamed gallbladder. And so what we do for that is we can do lithotripsy, or try to break up the stones, or we can do surgery to remove them, okay? Or there are drugs that can work on them too, okay? So that's what the pancreas is doing, right? The pancreas makes amylase to break down starch, and lipase to break down fat, and peptidases that break down protein, and the bicarbonate is there to neutralize the stomach acid, okay? You don't need to know the different peptidases, okay? These are all peptidases here. Just know that they act on protein, right? And there's nucleases that break down nucleic acids, okay? And we talked about pancreatitis, right? It can be caused by drugs and excess alcohol, viruses. And the danger there is that if you block the pancreatic duct, the pancreas can start to digest itself, and then you have to live without a functioning pancreas. There's your liver, right? It's got lobes. This is the front of the liver, and this is the back of the liver. There's your gallbladder. And that right there is the hepatic portal vein, okay? This is what receives blood from the digestive system, and then that blood percolates through the liver and eventually goes into the inferior vena cava and back up to the heart, okay? And while the blood's percolating through the liver, we're adjusting the nutrient content, we're adding plasma proteins, we're detoxifying the blood, we're removing pathogens from the blood, okay? All that good stuff. And then that treated blood will go into the inferior vena cava, back to the heart, okay? So that's liver's function, right? Detoxifies blood, stores nutrients, stores iron and vitamins, makes plasma proteins, makes starch. Animal starch is called glycogen, right? And can put glucose in the blood when it breaks down that glycogen, okay? So in a way, it's your body's kitchen and pantry, right? It's your kitchen in the sense that it can make glucose fuel to put into the blood. It's your pantry in the sense that it stores fuel for later. Okay. It also makes urea, which helps us to clear nitrogen from the blood at the kidneys. Okay. It makes bile, right? We know why we need bile. Disorders of the liver, hepatitis means liver inflammation. Okay. What causes it? Toxins, viruses. Okay. And this can lead to liver failure or liver cancer. Right. If you lose liver function, you die. Okay. Cirrhosis is where the liver gets fatty because of scar tissue, and that's usually due to abuse of the liver by excessive alcohol and recreational drug consumption. This is one of the reasons why if people mistreat their liver early in their life, they end up not getting life-saving drugs later on, because one of the liver's job is to clear all drugs from your system. And if we give you a drug dose and the liver can't clear it, then you're going to end up dying, right? So if an alcoholic with cirrhosis of the liver gets hepatitis, that's usually a death sentence because the liver can't take that double shot. Okay. Jaundice is the yellow tint to the skin and the whites of the eyes when the bilirubin builds up. The liver does have the ability to regenerate, but takes time to do that. All right. The gallbladder is where the bile is stored. The liver makes the bile, stores it in the gallbladder, and then it gets concentrated there. And then when you need it, the gallbladder will squeeze the bile into the small intestine through the cystic and the bile duct. Okay. The bile salts are important to emulsify the fat, right? That's to break the big droplets of fat into tinier pieces so that they can be eventually absorbed into the lymphatic system. And then from the lymphatic system, they'll eventually get into the blood. If we didn't do that, the enzymes wouldn't have enough surface area to do their work. Okay. If you block the bile duct, you have something called obstructive jaundice, which is the buildup of bilirubin in the rest of the body because the liver can't clear it by making bile, which eventually gets cleared as in your feces. Okay. Now, with chemical digestion, we're talking about what happens at the molecular level, right? And the tools that do this are what are called hydrolytic enzymes that use water molecules to split bonds in complex carbohydrates and amino acids and triglycerides. Okay. And we do that so that we can get them into either the blood or the lymph. And they all work at a particular pH. And it's usually the pH where they're secreted, right? So stomach enzymes work at a low pH because there's stomach acid there. The rest of the enzymes work at between pH of 7.35 and 7.45. Okay. Salivary amylase breaks the carbs into maltose. Pancreatic amylase digests starch into maltose. Okay. It's carb digestion. And then there are brush border enzymes, which are attached to the lining of the small intestine that finish the job, right? Turning all of the disaccharides into monosaccharides, right? Sucrose, lactose, and maltose are broken down by their individual enzymes. Okay. Hold on just a second. Now, if we move on to just a cartoon showing you how this is broken down, you can just see that we're moving from a long polymer to shorter pieces to individual links in the chain. And that's how it gets across the lining and into the blood, right? It's the same principle that we use with peptidases, right? Protein digestion begins in the stomach, and then it finishes in the duodenum and with brush border enzymes that are lining the border, okay? So the idea is that we go from a long chain to shorter chain to finally individual amino acids. And it's in that form that we're going to be able to make it to the blood supply that goes to the liver, right? Proteins, peptides, peptidases act on that, and then amino acids are going into the blood, okay? So it's a stepwise process, okay? Fats are emulsified by bile, and then the pancreatic lipase continues to break down into glycerol and fatty acids. And you can see here how that works, right? The fat globules get emulsified by the detergent bile. The lipase continues the chemical breakdown, and then the monoglycerides and free fatty acids go into the lymph. Okay, hold on just 1 second. Hold on just 1 second, guys. Yeah, go ahead. Okay, we're back. All right, so the point being, it's a stepwise process, and anything that interferes with any of these steps means that that stuff won't get absorbed into either the blood or the lymph, and so you won't get the nutrient value out of it. It'll end up in your feces. This is why, for instance, people that have lactose intolerance, they can't break down lactose. So if we go back to like where the carbohydrate part was, they get stuck at this step, right? At the lactose step. And so what happens is this is going to move through the small intestine into the large intestine, where the bacteria are going to go crazy and produce gas and distension and pain. All right. That's what lactose intolerance is all about. Okay. As we get older, the system doesn't improve, right? More GI disorders, more cavities, more gum disease. Hiatal hernia is a risk. That's where the stomach actually pops through the diaphragm and into your chest cavity. And that can result in emesis, vomiting, right? That can result in damage to the stomach itself, Heartburn and GERD are more frequent. And that's because muscle tone weakens. So it's harder to hold the gastric juice in the stomach. Peristalsis gets slower, and that's why we tend towards constipation. That's why you need fiber as you get older in your diet, and water. And peptic ulcers may happen more frequently, and that's just, again, probably due to the thinning mucus, right? Because you've got cell death, you've got less mucus production. Diverticulosis and constipation can result from not enough fiber. The liver can shrink. You can have gallbladder problems. Gallstones can crop up. You can end up with cancer, hemorrhoids, and incontinence. Okay. So again, it's not a situation that improves as we get older. The alimentary canal is part of the endocrine system. As you know, hormones are made by organs like the pancreas. There's also hormones made by the digestive system itself. Okay. We need nutrients and vitamins and minerals in order for the body to function, right? So if we don't have a digestive system, we don't get that benefit, right? You know about nutrition, right? The interaction between food and the organism is what sustains it for energy and building blocks, okay? And a balanced diet contains the nutrients in correct proportions to support that, and they enter the blood and are distributed to the tissues. We've talked about these essential molecules. This is basically a review part that's on the digestive chapter. And we're going to talk about MyPlate. I think we may have already talked about it a little bit. We're going to talk about MyPlate in the future as well. It's just a government recommendation for a balanced diet. We're going to talk more about vitamins down the road, all right, and why we need them. These are some of the roles of vitamins and where you get them in your diet. We're going to talk about minerals, okay? This is where minerals come from, all right? Eating disorders, obesity. You're taking in more calories than you're burning. Risk factors. Well, risks to your health. Hypertension, diabetes, stroke, heart attack, okay? All of that. Congestive heart failure, okay? Bulimia and anorexia nervosa are basically starving yourself of calories because of body image problems. This is a psychological disorder. In bulimia, it's binge and purge, where you eat a lot and then you either get rid of it by inducing emesis, vomiting, or using laxatives, right? Or excessive exercise, all right, is another way to do it. You can erode your teeth with the stomach acid. You can erode your esophagus with the stomach acid if you're using throwing up as a way to do it. If you're using laxatives, you can have electrolyte imbalance. You can have water imbalance, okay? Basically, it's not good for you. Anorexia is just starving yourself, right? So if you starve yourself, you can't maintain tissue. You end up eventually dying, right? Because you don't have any energy, you don't have any building blocks. Before that happens, you're going to see hypotension, irregular heartbeat, constipation. You're going to be cold, bone density will drop, your skin will dry up, menstruation will stop in females, muscle mass will decrease in males. And you can see examples of both here, right? Anorexia on the left and bulimia nervosa on the right. Right? These are psychological disorders. Okay, so that's all I've got for today. I have put the notes up in chat for you guys to grab. All right, and you guys have the practice exam. All right, so the way to do that, you take the practice exam as if it were a real test, and you check what you answered versus the key, and then you see where you're confused. And if you can't find the information in either the podcast or the notes or the materials that I've sent you, right, that's when you find me, okay? Now, I've got tutoring hours on Friday, all right, from 5 to 7 p.m. I will send you that link. That's tutoring for all the schools I teach at. And if you have a question, when you come into that room, what you want to do is identify your school and your course so that I know who I'm talking to and what they need help with, okay? And it's just a free for all. You can come in, you can ask me about nutrition, you can ask me about math, you can ask me about A&P. It doesn't make any difference. Okay. We can practice answering questions. We can work problems, all of that stuff. Okay. So I will shoot that link to you guys after class today. And I'm also going to shoot you the links for last week's podcast and this week's podcast so that you've got that. Remember that the exam is due by 11 o'clock on Sunday. Okay. So you've got that much time to get it done, but do remember that it is timed, right? So when you pop it, you have a certain amount of time to get it done. I believe it's on the exam, but I'll email you the amount of time you have. I think you got like 1.5 minutes per question. And I think it's 30 questions, I'm pretty sure. Okay. So it's like 45 minutes. Okay. But if you take the practice exam and study the material, you should be in good shape. Okay. I know I kept you guys over time. I'm sorry about that. Do you have any questions before we bump out?
So the exam is due by Sunday, 11 p.m.?
Yeah.
Okay.
Yeah. So you got plenty of time.
Will the exam pop up on student portal, or is this a PDF when you send?
It's going to pop up on the student portal. You'll see it. You should be able to see it in the calendar now, I believe. You go to the calendar, it'll be there. Mm-hmm.
Okay.
Yeah. Any other questions?
Do we have any homework for this week?
Let me check real quick. I don't think so. Let's go to, where is Adobe? What do you got here? Week 4. Just keep working on your disease project. That's it. But nothing that I'm sending out. Okay. Remember that you don't have to send me the practice exam. That's for you to practice with. Okay. That's your training exercise. And you also don't have to send me the class notes, right? You just need to send me your homework. The notes there, the PowerPoint notes, that again is for you to write on and keep and study from. Okay. Any other questions before we go?
I have a question. We picked up our books, the ATI books for nutrition. What do we need to do with those, or if anything?
Well, okay, that book, that little teeny tiny book, I actually sent it to you as well, right, as a PDF. So you've got it.
Okay.
So that book is going to contain some of the material that you need for the exam. The rest of it's going to be in the podcasts and the notes and the other posted material.
Okay, thanks.
Anything else?
Are you sending notes through email, because I'm not seeing them in the chat?
Today's notes I put on chat.
I don't see them in the chat.
Go to chat.
I am.
You'll see Digestion Nut 100 form.
It's nothing. It just say chat.
I don't have them either.
Okay, well, I will send it as well. Okay. But I think it's also posted in the portal under resources, but I'll send it.
Okay, thank you.
Okay.
And you said no homework because my phone
No
is
homework.
going in and out.
Just study. Just study. Study and work on your disease project. We cool? We good?
Yes, sir.
All
Y'all
right.
have a great day.
You have a great day.
Thank
Drive
you.
safely.
Have a good one.